Caregiver burnout, causes, signs, and ways to cope. Hi, I'm Gabrielle Juliano-Villani. I'm a licensed clinical social worker, and I specialize in burnout, chronic stress, working with people who have chronic pain and chronic illness, and older adults. So let's talk about caregiver burnout, what causes it, and ways to prevent it. Caregiver burnout is feeling overwhelmed physically, emotionally, spiritually, and mentally when caring for somebody else who has a major health condition. It occurs when people have an extended period of stress associated with their role as a caregiver. Oftentimes, they're not even aware of it because they're so preoccupied with the person that they're caring for. People who experience caregiver burnout often feel that they are being pulled in many directions. They're exhausted, and this can leave them feeling overwhelmed, tired, and generally dissatisfied with themselves and their relationships. This may also impact their ability to navigate daily tasks for themselves, which can leave them feeling immobilized and helpless. Caregiver burnout occurs because they are focused on taking care of others. They're not paying attention to what is happening to themselves along the way, and they either don't see or ignore their own red flags or needs that they need. They might become unaware of negative changes in their physical, mental, spiritual, and emotional health. This dynamic, when extended over a period of time and coupled with unrealistic caregiver expectations, can lead to burnout. Johns Hopkins Medical Center describes the common causes of caregiver burnout. Emotional demands resulting from the care receiver's condition. There's no way to make your loved one well, and an extreme degree of physical and emotional attention is needed. Conflicting demands, trying to meet demands in your own life, at work, with your family, and also of the person that you're caring for. Ambiguity of roles. Sometimes it's hard to differentiate what exactly their role or their identity looks like in their life and for the person that they're caring for. Workload. There's simply too much to do. Conflicting policies and procedures. This can prevent professional caregivers from doing what they believe is appropriate and family caregivers receiving what they want and need. Lack of privacy. There's no time to be alone. Common signs of caregiver burnout include social isolation, feeling depressed, feeling irritable, changes in your sleep, losing your temper, feeling out of control, increased anxiety, feeling helpless, loss or negative changes in your relationships, revenge bedtime procrastination, increased use of alcohol or drugs to cope, not being able to focus or concentrate, and having increased anxiety, or loss of interest in things that you used to enjoy. The good news for caregivers who experience burnout is that there are many options available to help you cope if you need them. The most important step, and oftentimes the most difficult one, is to acknowledge when you need help and then to ask for help. If you reduce your stress and either recover or prevent your own burnout, that will help you be a better caregiver overall. Here are some key ways to cope when you're a caregiver experiencing burnout. Set realistic expectations for yourself. Focus on what you can control instead of getting frustrated about what you can't control. Celebrate the small victories and feel good about them. Allow yourself time to rest and recharge without feeling guilty. Do something every day to promote your own health and well-being, like exercising, drinking enough water, and getting enough sleep. Pay ongoing attention to your body, your mental, spiritual, and emotional well-being. If anything feels off, make sure you tend to that as quickly as you can. Work with a therapist for one-on-one, group therapy, or even family therapy if needed to manage stressors. Investigate online caregiver support communities and also get connected in your own community. Find out about resources that are available to caregivers in your town or city. See your doctor to take care of yourself. Also important that you stay up to date on your own well-visit exams or vaccinations. Use respite care. Taking a break sometimes is one of the most important things that you need to take care of yourself. And finally, have a good support network of family and friends that you can confide in that are not judgmental. Final thoughts. Stabilizing your own emotional, mental, and spiritual well-being should be your goal. If you're feeling good and taking care of yourself, you are a better caregiver for your loved one. You can't care for somebody else if you don't care for yourself first. If you are feeling caregiver burnout or any of the symptoms or signs that we listed, reach out to your support network and remember that therapy is always available to give you perspective, space, and support to work through this tough time in your life.